Are you on Medicare and have you done a policy review of your plan for 2026? Because we can certainly help. Hi, I'm Tommy at medicalinsurancetoday.com. So it's early March 2026. I want to talk about a couple of educational points to consider for Medicare recipients. So at our agency, Medical Insurance Today, we are constantly in touch with our clients at least twice a year to do a policy review to make sure that you have the right coverage and to make sure it's the right price and that you are connected to your doctors and that all the things are lining up for your health care as best as they can, that you have full knowledge of what's going on with your insurance. So we're reaching out to folks, and many people are not aware of this season right now that's January, February, March for Medicare recipients. That's called the Open Enrollment Period, OEP. So at the end of the year, you have your October, November, and December 7th deadline. That's the annual election period for the change plans for the next year, AEP. Now in January, February, and March, there's a specific window of time in the OEP, the Open Enrollment Period, for Medicare Advantage recipients to change their plan. So we're finding a lot of folks that didn't read their benefit changes for 2026, and they're coming in saying, I didn't know my prescription went from X to Z, or my copay went from X to Z, or any of the changes that happen yearly with plans. So it's often prescriptions with Medicare, doctor changes, network changes with plans, and oftentimes, with the market the way that it is, healthcare plans are changing annually on a wide scale. So it's something we monitor closely. We're very involved and informed on what those changes are and what's happening with those changes, and we're helping a lot of folks that are going, I'm not happy with this plan I'm on, and I can get into something better. And to define the OEP again, it is January, February, March, specifically and only for people with Medicare Advantage. So no Medigap changes, but just Medicare Advantage. And you are guaranteed acceptance one time. You can change your policy. So it needs to be a determined and distinct change that you're aware of. And you're going to roll into a new plan for the remainder of 2026 from your old plan. So you do have windows of change that many Medicare recipients are not aware of. So we're helping a lot of folks that didn't look at their benefits at the end of the year, didn't take our calls when we reached out to them in September, October, November. And they're saying, well, something changed and I need to make a change. So we can help with that. There's also another window of opportunity for people to change plans under the FEMA declaration, Federal Emergency Management. But that's another discussion for another time. So if you are on Medicare Advantage, if you're having troubles with your plan, please reach out to us. medicalinsurancetoday.com. We would love to serve you.